Welcome back to Talkpoint. Today we are focusing on a pressing issue affecting millions of Americans: healthcare costs. Recent reports show that out-of-pocket medical expenses continue to rise, promoting renewed debates over healthcare reform, insurance coverage, and the affordability of essential services. Here's a closer look at what's driving costs higher and what it means for patients and families. Americans are spending more than even or ever on healthcare. Out-of-pocket expenses, including copays and deductibles and prescription costs, have steadily increased. While insurance can cover some costs, many families face significant financial burdens, particularly those with chronic illness or requiring specialized care. Rising costs are also influencing choice about whether to seek treatment, with some delaying care due to affordability concerns. This is the footage of patients at pharmacies, doctors explaining treatment costs, and families budgeting. Prescription drug prices are a major contributor, especially medication, insulin, and other essential drugs have been price hikes that far outpace inflation. Hospitals and clinics also report higher operational costs, which are often passed on to patients. Combined with insurance premiums, many Americans are finding healthcare increasingly difficult to afford, sparking infrastructure and concerns nationwide. Healthcare affordability is not just a personal issue, it's a national concern. The US spends more per capita on healthcare than most developed countries, yet millions remain underinsured or uninsured. Analysts say the rising costs affect economic stability, household finance, and even public health, as some Americans delay on or forego necessary care due to expense. This is the footage of lawmakers discussing healthcare press conference and policy proposals. The debate over healthcare reform has intensified. Lawmakers are considering measures to reduce prescription drug prices, expand coverage options, and limit prices surprise medical bills. Proposals range from strengthening Medicare and Medicaid to encouraging private insurance reforms and promoting price transparency for medical services. Experts argue that tackling rising healthcare costs requires a multifaceted approach, as negotiating drug prices, regulating hospital charges, improving competency among insurers, and supporting preventive care to reduce long-term expenses. Patients, however, continue to navigate a complex billing system, often facing unexpected charges despite having coverage. Animation showing potential solution: insurance reform, government programs, telehealth, and preventive care initiatives. Technology and policy reforms offer potential relief. Telehealth services, preventive care programs, and digital health platform can reduce costs while improving access. Policy initiatives aimed at privacy, transparency, and affordable insurance options may also see the financial strain on families. However, systemic changes requires a collaboration between lawmakers, insurance, and healthcare providers and patients themselves. Rising healthcare costs remain a major concern for Americans. While reform efforts continue, millions of families are still struggling to manage medical expenses and access with quality care. Addressing affordability, insurance, accessibility, and transparency is critical to ensuring that healthcare works for everyone. Stay with Talkpoint or for ongoing coverage of healthcare policy and its impact on everyday Americans. Thanks for watching. Comment below: have rising healthcare costs affected you or your family? Don't forget to subscribe to Talkpoint for daily updates on healthcare policy and current events.